and welcome to this webinar. My name is Marije van Dalen and I'm a PhD student and research psychologist at the Erasmus MC Sophia Children's Hospital in the Netherlands. During this webinar, I will tell you something more about emotional and behavioral problems in children with a cleft lip with or without cleft palate and in children with an infantile haemangioma. This talk is based on a scientific article. If you wish to read the article, I have included the link in the description below in this video. So, living with a cleft lip with or without palate or an infantile haemangioma can entail some challenging situations. First of all, children may be teased or bullied based on their appearance. And of course, this teasing and bullying can impact their self-esteem and overall psychological well-being. And second, for children with a cleft palate, speech problems may occur. These speech problems may cause problems in the way the child can express himself, and it can also add an extra burden as the child may need to see a speech therapist. And third, the child may need to go to hospital. These hospital visits can be very distressing for the child, especially in the case of surgical procedures. Children might also have to miss out on school, which can pose an extra problem for their academic development. And as a consequence of these challenges, behavior problems may develop. Behavior problems are often categorized into internalizing and externalizing problems. Internalizing problems are things that go on within a person. So, for example, anxiety or depression. Externalizing problems are maladaptive behavior towards one's environment. So, for instance, aggression or a diagnosis such as ADHD. It is not clear from previous studies whether children with a visible difference experience more or less emotional and behavioral problems than their peers. Some studies show that these children experience more behavioral problems than their peers. However, other studies show that children with a visible difference don't differ from their peers on the amount of emotional and behavioral problems they experience. What we do know from earlier research is that there are several factors that can influence the amount of emotional and behavioral problems children experience. The first factor is the visibility of the condition. The visibility can be divided into an objective visibility and a subjective visibility. The objective visibility is the visibility as rated by a physician. The subjective visibility is how visible a person experiences his condition to be. And contrary to what you might expect, the objective visibility isn't directly related to psychological well-being. There are indications that the subjective experience is much more important in predicting someone's psychological well-being. A second factor that can influence emotional and behavioral problems in children are the parents. Parents are affected by the child's condition and their emotions may influence the child. There's also evidence that parents with mental health problems are more likely to have children with mental health problems. A third factor is other difficulties related to the condition. When a child has other conditions apart from the cleft lip or infantile haemangioma, so for example speech problems or a learning disability, it is likely that this child will show more emotional and behavioral problems. In the current study, we sought to understand whether children with a cleft lip with or without palate, so that includes children with an isolated cleft lip and children with a cleft lip and a cleft palate, and children with an infantile haemangioma experience more emotional and behavioral problems than their peers. We also wanted to know whether the factors that I described in the previous slide influence behavior problems. To study this, we asked parents of children aged 1.5 to 12 years old to complete questionnaires. There were two groups. The first was parents of children with a cleft lip with or without palate. I will refer to this group as cleft lip from now on. A total of 119 boys and 63 girls participated, and their average age was 7.3 years old. A total of 309 parents participated. For some children, both the mother and the father participated. This provides an extra insight for us, as sometimes parents may not always perceive their child in the same way. The second group was parents of children with an infantile haemangioma. A total of 8 boys and 25 girls participated. The average age was 6.6 years old, so that's a little younger than the 7.3 we just saw in the cleft lip group. And once again, a total of 48 parents participated. For young children, it's very difficult to complete questionnaires about themselves, so for our studies, all questionnaires were completed by the parents. The parents completed questionnaires about their child on internalizing problems, externalizing problems, the visibility of the condition, and additional condition-related difficulties. Parents also completed questionnaires about their own affect and feelings. To assess whether children with a cleft lip or infantile haemangioma experience more internalizing and externalizing problems than their peers, we compared the questionnaires the parents completed to a norm group. A norm group is essentially a very big group that is representative of the general population. And within this group, children are compared to other children of the same age and gender, so their peers. Our analysis showed that parents of children with a cleft lip reported less internalizing problems and less externalizing problems for the children when compared to parents in the norm group. We found the same result for parents of children with an infantile haemangioma. Their children also experienced less internalizing and less externalizing problems than their peers. Our second aim was to study what factors influence the presence of internalizing and externalizing problems. First, we looked at what factors influence the amount of internalizing problems. Parents reported more internalizing problems when their child had more additional condition-related problems. Then we looked at the visibility of the condition. For children with a low to average visibility, a subjective visibility, no relation was found with internalizing problems. For children that had an average to high visibility of the condition, we found that the more visible the condition was, the more internalizing problems parents reported. We also found that parents that experience more negative emotions themselves also report more internalizing problems in their child. And lastly, mothers reported more internalizing problems than fathers. So parents have different visions on the amount of internalizing problems their child experiences. And then we looked at what factors influence the amount of externalizing problems. Parents reported more externalizing problems when their child had more additional condition-related difficulties. And mothers reported more externalizing problems than fathers. Other factors, such as the visibility of the condition and the parental effect, did not influence the amount of externalizing problems the child had. So from the study we can draw two major conclusions. The first is that, contrary to what we expected, children with a cleft lip or infantile haemangioma experience less emotional and behavior problems than other children. And second, the amount of problems they experience is influenced by several factors, the most common ones being additional difficulties related to the condition. Okay, thank you for listening to this webinar. If you have any questions, please reach out to us, and otherwise I'll hope to see you in another video. Bye!